shuttle relay. I mean, you may already have a shuttle. Okay, recording. So we're looking inside the left shoulder here. We're just getting started. There's a lot of torn tissue around the biceps tendon, so we're going to be also doing what we call a biceps tenodesis. You can see the base of the biceps here is torn. You also have a fair amount of arthritis, which we'll talk about in a little bit. Right now we're just using a shaver just to remove some of the torn labrum here. And then in just a minute we'll sneak behind the biceps just like that. And here's the torn rotator cuff. So we've got a lot of work, exactly what we expected, so no surprises. We talked about the biceps. We weren't sure, but now we're sure. And we'll need a pop lock suture anchor for that. 3-5. Okay, and so now we'll look around the rest of the shoulder. We'll show you some more in just a minute. Okay, so you've got a fair amount of arthritis in the shoulder. Luckily, we don't walk on our shoulders, so a lot of people can have this amount of arthritis and still not have much pain. We've smoothed out the labrum, and we've already released the biceps, and so now it's time to get to work in the subacromial space on the rotator cuff stuff. So we'll go off on the video, show you some more in a little bit. Okay, so here's the tear. You can see the hole. That's the biceps tendon on the left, back of your shoulders to the right. Let me focus a little bit better for us. There we go. And so you've got this big tear here. It's a big split tear. So we got our work cut out for us, but we can get this fixed. Hold the bicep sutures. I'll show you some more in a little bit. Okay, so we've got our first suture anchor in. You can see it right there. And now we're going to go ahead and take an instrument we call a crochet hook just to start manipulating the sutures so that we can pass them through the tendon. So we're going to take this solid blue one first. That's going to go out right there. Okay, we're all done here. It's going to be hard to see because that hole's completely eliminated. So there's some of the sutures. We also tenodesed the biceps. But there's our anterior cannula, just for reference. And we've taken that and anchored it all the way back to the bone. So everything's moving as a unit. We're going to clean up a little bit of that right there that you see. But otherwise, we're pretty much done. So good luck to you now, okay? Bye-bye.